All right, good afternoon or almost good afternoon, everyone. My name is Melissa Briley and I am the Share Navigator, and I will be helping with today's Health Council talks. So I'm really excited you're here. We have a couple of minutes. It looks like we still have people trying to join the room right now. So before we even begin, Michelle, if you can just hang tight and give me about another 2 minutes, and then I think we'll go ahead and begin.
Of course, no worries.
Thank you, Michelle. And for all of you that are joining us by Zoom, thank you so much for your time this afternoon. We have a really exciting presentation. And if you could do one thing for me, if you could go ahead and put your name and the organization that you are representing in our Health Council talks in the chat, we'd greatly appreciate it. Thank you. And we'll start in 2 minutes. All right, so good afternoon. Finally, it is 12:02. We'll go ahead and begin our Health Council's talk for this afternoon. And thank you and welcome again to all of you. And just so thankful that you're able to join us. My name is Melissa Riley, and I am the Share New Mexico Navigator. And surprise, I'll be online with you all today. Staff is really busy, and because we don't have Joseph available to us because they've moved on, we just find ourselves just a little bit short-staffed just for today. So with that being said, we have our recording going for today's Health Council Talks. And for those of you that are just joining and did not hear my friendly request a short while ago, if you could put your name and the organization that you're representing in the chat box, we would so greatly appreciate it. Today, we have a really exciting presentation, and we are so happy that Michelle Rincon from the DEA is here and will be sharing a presentation and discussion with us about her work and how we can all really gather and rally around some of the information that she's presenting, and maybe how we can make a connection with the good work that she's doing. So if you have any questions for me, any logistical questions, please do not hesitate to put those in the chat. I'll be happy to respond. And remember, at the end of today's Health Council talks, we also have an evaluation. Your response, your feedback on our evaluations is really important to us. And it gives us some ideas of where we go, what we're doing that works for you, our audience, and how we can better support you as well. So with that being said, Michelle, I am going to turn it over to you. And you should also have share capabilities, no pun intended. So if you'd like to go ahead and begin, we're ready.
Okay, great. Thank you so much, Dr. Riley. And then just to double check, how much time do I have? I don't want to go over the allotted time.
Right. So we end at 1 o'clock. So
Oh,
you
okay.
about 50 minutes plus.
Okay, I'll try not to talk too much. That way I have some time for questions if anyone has any questions. But thank you so much for having me here today. I'll go ahead and get started then. While I share my screen, I will introduce myself. My name is Michelle Rincon. I am the Community Outreach Specialist for the DEA El Paso Division. And my role here is to, help with resources, awareness, presentations, trainings, let you all know what we do. That way we can help you with those resources for your events. If you have any specific events dealing with parents, children, youth, you name it, and I'll explain more along the way. Can you all see my screen, by the way, or not yet?
Yes. Yes.
Okay, perfect. Awesome. And then if anyone has any questions throughout, please let me know, and we can go ahead and and answer those questions for you. And I don't know if I shared my sound. I don't think I did. Oops, sorry. Can you all hear me? I didn't realize I was on mute.
Yeah, we can hear you now.
I apologize. Can you all still see my screen?
Yes.
Okay, perfect. And can you all see the PowerPoint and not the notes section? There's nothing in the notes, but okay, awesome. Thank you. Sometimes Zoom is a little weird, and the browser, I'm using the browser one, so I want to make sure that we're seeing the same thing. Okay, so again, my name is Michelle. I'm the outreach specialist. I told you a little bit about what I already do. I'm going to go ahead and expand on that. That way you know what resources and what tools are available to you on our outreach side. That way you can use them as you wish and as many times as you want as well. And I do have to say, though, that everything that we offer, it's free. We never charge for anything, whether that's presentations or tablings or trainings, resources, anything like that. We don't charge for any of that. Okay. And just a little bit about myself. Before I got into this role, I was working at a nonprofit, actually, in Doña Ana, so in the Las Cruces area. I was oh God, what was my title? I was like a prevention program specialist. I was focusing on substance use prevention in adults and in teens. And before that, I was at NMSU getting my master's in public health, where I also focused on substance use disorders among adults and teens and ways to prevent that, as well as mental health, because as we all know, substance use disorders and mental health sometimes go hand in hand. Not always, but some of the times. And so today I'm here to talk to you about what we have for you all, for your communities, for your events, and things that you can use for your community outreach. of course, events or things that you might have going on. So just really quick, as far as an overview, DEA is not just agents and banging down doors and getting the bad guys, but it is, right? We do have our agents that do get those bad guys and do make the cases and do get the drugs. That's a very important part of DEA. But, DEA's mission, what we do is in our name, right? We enforce federal drug law. That is our main mission. We are the only federal agency that's a single mission agency, meaning where FBI focuses on 200 plus crimes, the DEA focuses on just one, which are drug crimes. So our focus is on people who make drugs or who sell drugs. Our focus is never on people who are using drugs. That's a different topic. Okay, so we are focused on those that are making the drugs and those that are selling the drugs. Now, apart from agents, we do have other job series in DEA. We have diversion investigators, we have intelligence research specialists, we have chemists, scientists, and of course we have not only 23 divisions, which we used to have, but now we have about 26 in total, because we did grow those divisions across the nation. Okay, so who are we? All right, map of the U.S. So if you look at that green square at the bottom where El Paso is, that is where our main field division is. That is our field division of our El Paso division. Now, we cover the entire state of New Mexico. The entire state of New Mexico is our responsibility, and also 17 counties of West Texas. Now, for us, what does that mean? Well, that means our agents make cases in that entire area, and for me, that means that that area is my responsibility as far as presentations, resources, trainings, making sure that everyone in that specific area knows that we have help that we can offer them should they need it. Okay. All right, so our workforce. We talked about agents and the other job series. We have diversion, which focuses on investigating doctors who may not be such very good doctors. Maybe they prescribe a little bit too much medication. Maybe they are trading medication for more money. Maybe they are trading it for a specific job they want done, which of course is illegal. So our investigators get involved. And then lastly, we have our outreach section, which is pretty new. Let me hide this really quick. Which is pretty new. This position, the position that I'm in, has only been here for a little over 3 years. It's not been here for very long. So all of this is very new, but outreach has always existed within the DEA. Can anyone tell me what happened in 1985? If you want to write it in the chat, that's fine. I can see it right here. If you want to unmute yourself and let me know, that works as well. But something happened in 1985 that changed DEA. DARE, okay, it's close to DARE, war on drugs. Okay, anything specific that anyone can maybe mention? It definitely had to do with DEA. Something big happened with DEA in 1985. And it's right here, right on the screen. I'll give you a hint. It's on the screen. It's Red Ribbon, right? That's how a lot of people don't know that. This is how Red Ribbon got started. If you know the history or a little bit of history with the DEA, in 1985, Enrique Camarena, which was one of our agents, got kidnapped, tortured, and murdered by one of the cartels that he was investigating. So what happened is that when his body was found, family members, friends got together, they came together, and they started wearing a red ribbon in his honor, saying that they were not going to be using drugs because of his sacrifice, that no one was going to be using drugs, everyone was going to stay away. And so that's how Red Ribbon got started. It was because of one of our agents being kidnapped, tortured, and murdered, where his family and friends had a response to that, of course. And that's how this got started. So Red Ribbon is an outreach initiative. It is an outreach event that happens every year from October 23rd through the 31st. And even though this is how outreach was born, I like to say, in DEA. It progressed and it evolved as the years went by, and now we have a position, which is what I do now, that's dedicated to just community outreach to bring that awareness back to the community. That makes sense. Okay, so what do we do exactly? Because a lot of people think DEA, and they don't think outreach, they don't think awareness, they think agents with guns, right? And bad guys and drugs. And they're not wrong. That's not wrong. It is completely correct. But there's way more to that. There's way more to DEA than just agents. So this is our entire outreach team. That's me and my colleague, Carlos Briano. If you watch the news, you might have seen him on the news. He is a public information officer. We each have two very different roles that we help each other with our roles, because the entire state of New Mexico and 17 counties of West Texas is a lot for just me, for just one person. I can't reach everyone. There's no way I can be in two places at once doing different presentations. So Carlos, my colleague, covers for me if another request comes in and I can't do it. And I do the same for him. I cover for him when he can't do a presentation, or sorry, when he can't do media because he's doing something else with media. And so I cover for him. So we help each other quite a bit, but it still can be a lot. Sometimes even with both of us, we can't take care of everyone, which is why we really like to emphasize the importance of our train the trainers, where if you're ever interested, you can take a training with us. We train you in the THC and fentanyl presentation or the one pill can kill presentation. And you have that presentation where you can go and give that presentation to your colleagues, your coworkers, friends, family, whoever you feel like needs it. Or maybe they request a presentation and they'd be like, hey, do you have anything on fentanyl? Do you have anything on THC? You can take that training with us, and then you'll have all the information, the presentation notes, things like that, where you are equipped to go out there and do those presentations. But before I get too much into that, let me tell you what presentations we do have and presentations that we do offer. The general community, law enforcement, parents, teachers, really anyone. There's no limit to who can have a presentation or to who can request a presentation. We do presentations everywhere. And those include the One Pill Can Kill presentation, which is mainly talking about fentanyl, the global supply chain, talking about cartels, their movements throughout. We're talking about fake pills, how those fake pills are made. Also, we have a video of one of our chemists talking to you about exactly the science behind making those fake pills, if there is any, and then how those cartels trick and, unfortunately, sell these fake pills to vulnerable buyers, because there's a lot of them out there. The THC fentanyl presentation is mainly focused on THC, of course, and we get a lot of that information from NIDA. So NIDA, the National Institute on Drug Abuse. All of our information is, for example, also from the University of Mississippi. It's from institutions that have studied THC for decades. A lot of the information and facts in that presentation is never just DEA information, right? And we did that on purpose because we wanted people to know that this presentation is science informed. It is not just an awareness presentation saying, oh, THC is bad for you, don't do it. That doesn't work, right? We need to present the science. We need to present what we gathered from these different institutions to get you the most accurate information that we can, that way you're aware of the risks and dangers of THC in youth. And that's what this presentation focuses on. It focuses on the risks of THC in youth only. Okay, not in adults and not in anyone else. It's just those younger than 21 years of age. Our next presentation that we have is DEA 101. That presentation is basically what it says in the name, right? It's more information about the DEA. You get more information on the jobs that we have, careers, how many divisions we have, also past things that the DEA has evolved through. It's very more history informed, and if you want to know more about the DEA, that's a pretty good one. We also do career day presentations in schools all the time. So if you ever have a school that's looking for a presenter for career day, please let us know. We like to do those. The kids love it. We take the agent gear and the shield, and we have a big drug ID kit that we'd like to show, and the kids love to ask questions, and they love to try on the vest of the agents and take pictures. So that's a pretty fun one that we have. The community outreach presentation is this one. That one's the one that I'm presenting on right now. We also have a drug trends presentation. So that one is more focused on trends that are happening in your area. So if you're from the Las Cruces area or from the El Paso area, or maybe even Albuquerque or Rio Rancho, somewhere up north, Taos, let's say, you're going to be seeing different drug trends maybe than what El Paso is seeing, or you might be seeing similar. What I can tell you though is that New Mexico specifically, we do see a lot of fentanyl and meth. Those are the two top drugs that are seen constantly. Will that change? I don't know. Maybe, maybe not. But that drug trends presentation is given by one of our assistant special agent in charge that is here in El Paso. He has the most up-to-date information on that, so that would be given by him. And then lastly, our Red Ribbon presentations. If you're interested in Red Ribbon and you know that school is in session and you have teachers wondering or getting ready for that season, have them reach out to us if they like, and we can give them either ribbons, presentations, or both. I mean, depending on what they're looking for, we're here to help. So I'm going to show you just a few slides of an example of what the one pill can kill presentation looks like. That way you get an idea of what it is, because I know me explaining it doesn't really draw a very good visual. So I feel like a good visual is an actual visual that you can see. So these are just a few slides of that presentation. Does this image look familiar to anyone? Yes, no, maybe. Yes. Okay, great. So then some of you have seen this image. This is an image of fentanyl, right? 2 milligrams of fentanyl, a potential lethal dose of fentanyl. As we all know, fentanyl, it doesn't take a lot to become deadly. Unfortunately, it is very potent. And it's 50 times more potent than heroin and 100 times more potent than morphine. I mean, the fentanyl driving this crisis isn't just sold in fake pills, right? They're mixing it with other illicit drugs like heroin, meth, things like that. So we talk about that in that presentation. We also talk about the most common fake pills that we see. These are the top three: Oxys, Adderall, and then Xanax. So Oxys, they're the most sought after pill in general, social media especially. Adderall is very popular with college students, okay? And Xanax, unfortunately, that one's very popular with middle schoolers and high schoolers. Now, I know that's a very young age for them to be very interested in that, but in our area, what we're seeing, and I can tell you this for sure, in all the El Paso area, I can't tell you for the entire state of New Mexico. I think only you would know that, or maybe your teachers would know that, but for the El Paso area, Xanax is a pretty popular pill substance for middle schoolers for sure, unfortunately. So we talk a little bit more about that in this presentation. We talk about the cartels. Sinaloa and Jalisco, those have always been the top two cartels that the DEA has been focused on for a while now. And that's because they bring in the most drugs. They bring in the most fentanyl. And as you can see in this map, we talk about how they always head for the East Coast first, always. And that's why we see those drug trends in the East Coast before we see them anywhere else. And so we talk a little bit about that. And then we also talk about the global fentanyl supply chain and how the cartels move through the process of drug making up until their drug profits through cash, goods, and cryptocurrency. This one is a pretty popular slide, and I should say also a fact sheet that we have that, again, that you can have if you would like, of emoji drug codes. Now, this is a very popular one with parents, teachers, adults, because it gives them an example of how drug dealers communicate with their buyers. So let's say someone wanted a Xanax, right? In the Xanax, you have a capsule, you have a chocolate bar, and you have a yellow bus. Can anyone tell me why those three emojis were chosen for that specific substance? I guess it's fine too, if y'all want to guess.
I think the pill is pretty self-explanatory, but at least the bar for sure, the candy bar,
Sure.
the Xanax bars.
Right. Exactly. Thank you so much, Tiffany. Yes, exactly. Right. So the capsule is pretty self-explanatory, right? The bar is because Xanax or Xannies, as I like to call them, they're called bars. Sometimes they call them yellow buses. Why? I have no idea. I think sometimes they look like a yellow bus. It's yellow, it's long, it's rectangular, right? Like a bus. And so they use specific emojis. They don't use words, right? They like to be secretive and clever with their communication. And again, this is just an example, okay? I'm not saying that this is how they communicate now. This is probably already outdated at this point because as soon as we find out how they communicate, they change it up really quickly. But this is to give an example of how they communicate because they don't always use words. We also talk about, especially when we're talking to parents, how to check, your kids' phones. It's important to check your kids' phones if you have that trust bond in there already for suspicious texts, social media activity, cash app posts, things like that, that might spark some suspicious activity. All right, so our next presentation that I talked about is the THC one. Now, this one is again mainly for prevention among youth and young adults. So we like to give this presentation for parents and youth, especially in this area, in the El Paso area, where having paraphernalia or having marijuana or THC and being caught with it at school is a felony. And so in Texas. So for that, the JPD or the JPO, they have a specific program where they have us go in and talk to the parent with their kid who was caught with that substance, and they have us give this presentation to them. And it's a great program because a lot of them do not come back, do not get caught again, thankfully. But it is important information that I feel like parents and youth have to hear together because it does, again, like I said, this is information coming from NIDA. It is information coming from institutions that have researched this specific substance for decades. Let me know if there's any questions in the chat. Okay, thank you, Sarah, the Magic School Bus. Thank you so much. I'm going to try and keep up with the chat, but if I don't, I'm sorry.
Okay. That's okay. I'm here to help.
Thank you, Dr. Riley. I appreciate that. Okay, so changes in perceived risk. This is a graph that I like to show a lot to teachers or parents if they're in the audience, because a lot of substance use comes from perceived risk, right? If a youth or if a teenager does not see something as dangerous or risky, they'll probably do it, right? They'll probably try it. They'll probably take it. So heroin is very high up there as perceived risk, which means they won't take it. But marijuana, it's about 21.6%. So it's not that high, which means they're more likely to take it. We talk about facts. Again, of course, this is all coming from NIDA, the National Institute on Drug Abuse. That marijuana is addictive, depending on how often it is used, if it's used daily, if how many times it's used during the day. We talk about how it's 4 to 7 times more likely to be even more addictive or to evolve or initiate a substance use disorder in those who are younger than 18. We talk about the short and long-term effects on the brain. We also talk about the impacts it has on the brain by using marijuana on a daily basis, for example, for 2 years, like this teenager did. Those are not holes, by the way. Those are just areas of inactivity where the brain is no longer active at that time. It is reversible. I do like to say that. It just might take about, again, 2 years for that brain to become what it used to be again. And this is probably one of my most favorite crafts that I like to show parents, because a lot of the times when I'm doing these presentations, I get asked by parents and they say, why is marijuana so bad now? How come it wasn't that bad when we were growing up? Like, it wasn't that bad, but now it's different. Well, that's because the THC content has gone up. I can't speak for New Mexico, but I can speak for the El Paso area. When it comes to school resource officers, and when they confiscate that paraphernalia, those vapes, that THC, they're telling me, and they told me this directly, okay? I'm not making it up, but they did tell me that the content in those samples that they get is about 90%. It is not 14% like it was back in 2019 or 4% like it was back in the 90s. It is now around 90%, which again, we talk a little bit more about that in this presentation. I'm not going to expand on it too much. I just kind of want to give you an example of what this presentation looks like. We also talk about edibles, the importance, especially if there's parents around. I talk to them about the importance of please locking up your edibles, your stuff where youth and young hands can't reach it, or where they can't reach for them, because a lot of them do look like candy. A lot of them do look like cookies, for example, and sometimes kids don't know the difference. Or sometimes they do and they want to try it, right? It depends on the age. And then after that, we go into fentanyl. We talk about what the cartels are doing, how they're mixing up ingredients to make fake pills, where fentanyl is found. And then after this brief information, we go into a video, and then we play a game at the very end. It's called the fentanyl game, and it's like a guessing game, basically. Okay, and lastly, I'm not going to show you every single presentation, so just bear with me. This is the last presentation I will show you. This is our Operation Prevention presentation that we have, and training as well, because in DEA, we have a school curriculum that was made in partnership with Discovery Education. Now, if you're familiar with Discovery Education, they're the leading group and program in worldwide education. Now, we partnered up with them because we wanted something for schools, for teachers, that they could use in their classrooms to help raise the awareness of substance use, and how external factors affect our body, how outside substances affect our brain. So this is very science-based. It's very science-focused. I can't tell you that it's evidence-based, because it is not evidence-based. We are trying to get it there, but I can tell you it is very science-focused. It is science-based. It is based on evidence, right? Not evidence-based, but it is based on evidence that we have found from other research, and of course, in partnership with Discovery Education. Now, what does this include? It has lesson bundles, field trip series, student videos, self-paced module, which I've taken it. It's actually pretty cool, actually. The parent resource toolkit, educator webinar, which is on demand, and then the workplace module. We don't charge for any of this, okay? It does live online. Oh, it's also in English and Spanish, so it is bilingual. We don't charge for any of this. It does live online, and it gets updated. It gets updated at least yearly. So the digital lessons are from 3rd grade up until 12th grade. So you have elementary aged lessons, which focus on medication safety, and how to read a prescription bottle. Why are prescription bottles important? Why is it important not to touch another person's prescription bottle, right? What does it mean? Why does a doctor give you medicine? So things like that, where it helps the child understand um, safe choices and healthy choices even, and helps them understand the process of substances. They're not just drugs, but there's also medicine. Middle school, you get a little bit more into opioids. What are opioids? What do they do? What do they mean? Like, what exactly are they? What are they used for? And how is the community influenced by this epidemic? So you get a little bit deeper into it. High school, you get even more into it, right? So you talk about the public health crisis. You talk about how external factors like drugs affect not only the individual in that community, but the community as a whole. How does it impact? How do substances have an impact on the community, on the town, on the city, and eventually the state? So it gets a little bit further into that. Virtual field trips, these are pretty cool because you can pause them, you can go through them by chapters. Teachers don't have to look through all of it. They can do one chapter a day if they like. They can just do the entire thing in one sitting if they would like to do that. And they're not very long. It's about 20 minutes, 25 minutes at most. And then we also have student videos. These are videos that were made by students. And so we used to have student competitions. We don't have them anymore, unfortunately. The last one was in 2019, but these are they stayed on our website because they are very impactful. I mean, students, if you've worked with them in the past, they can do amazing things. And there's a lot of them that are super talented and they know how to do their stuff. So we left them up here because we wanted people to know that, sometimes a student's voice can change another peer's way of thinking, a peer's perspective. So we left them up here in case teachers wanted to use them. Maybe they wanted to show them to their students. I do have to say though that these were not made with Discovery Education, so they're a little bit different. Okay, these were made by students. I am going to show you a video. I'm going to show you this third place video by Jake and Cody. And so this won third place back in 2019. And I really do like to show this one because it seems to be pretty impactful for parents and for adults who are in the room. So let me go ahead and show it to you. Let me know if you cannot hear it. I did share my audio, but yeah, so just let me know.
I want to be an astronaut.
Can y'all hear?
Mars, and I want to choreograph a ballet on Mars, and I'm gonna have the dancers do the dance on Mars. I'm gonna be the first girl president of the United States. I'm gonna dye my hair purple. And I'm gonna have all the aliens on Mars. I want to ban homework. Look, I already have some of it done. I want to play the flute. I want to be on TV. I want a baby sister. And then they're gonna jump in the air, and they're gonna float. Because, it's space. I want a puppy. And when I'm in high school, because I'll try anything once. And it would be a great story. You only do it, once or twice. I'm going to try opioids. And I'm going to like it a lot. So I'll forget the only once or twice thing, and I'll do it more. And I'm going to get addicted to the point where I can't even think about breaking it. And I'm going to go to the hospital for an overdose. But I'll make it out okay. But that's not going to teach me anything. And I'm going to get back into it. And as soon as I get out of the hospital, I'm going to overdose again. And that time, I'm going to end up dying. And I want to have my gravestone on Mars.
Did you all hear that okay? Yeah, okay. So this is one of the videos that I sometimes show if there's parents around or teachers, if they work with youth, just because I think it's a pretty impactful video. And kids are like that, right? They're very goal-oriented. They're like, I want this, I want that. And so a lot of the times we don't realize that there's a lot of risks around them. There's dangers around them. And so it's our responsibility, not just as parents, but, as members of the community to help them, to guide them so that they don't fall into those same risks or dangers that are out there. We also have self-paced modules. These are great. It follows the stories of 3 teens If you want to try it yourself, I definitely recommend it. It doesn't let you go to the next section until you're done engaging with that one. So it is very engaging. It debunks misconceptions, and it's also available in Spanish. These are mainly for middle school and high school, though. We also have a parent toolkit that you can order for us for free, English and Spanish as well. If you have a specific event, or if you know of someone who has a specific event on with parents or with adults on substance use, and you want something for that audience, you're more than welcome to contact me and say, "Hey, Michelle, I have this event. I need this manual or this toolkit in English or Spanish. Can you send me 500 or 1,000 to this address?" Of course, definitely. The only thing that I ask you, though, is that you give me 2 to 3 weeks before that event happens, because these resources, these toolkits do not come from our office. They come from our headquarters in Arlington, Virginia. So it might take them a while to actually print everything out and then send them to you by the time you have that event. That's the only thing. This is the on-demand webinar that lives on our website. So if you know of a teacher who's looking for something to implement a substance use prevention awareness class or videos in their class, or a principal who wants to implement something in their school, or a higher level educator that wants to implement something in their district, they can use this on-demand webinar and get basically trained. We did train Albuquerque Public Schools in this curriculum with discovery education. We did put something together for them for all of their crossroad counselors, because they were the ones who were going to be giving this curriculum. And if you're interested in something like that, or if you know of a superintendent or of a principal or someone who is interested in that kind of training, please contact me, because we can definitely do something to help them with that training, of course. Okay, so now trainings for the community, right? I have already kind of talked about the One Pill Can Kill, the THC fentanyl presentation. So if you are interested in being trained in either of those presentations, let me know and we can get you on the calendar. We can either do it in person or virtual. I mean, whatever works best for both of us. Every training comes with the notes, the presentation, and also a link to either myself or to my colleague during the presentation. We're aware that everyone learns very differently. Not everyone learns by just reading notes, right? Sometimes they have to hear it. Sometimes they have to see it. So we try and accommodate all those different learning styles. We do tablings or booths. If you have an event coming up, or you know of someone who has an event coming up and you would like us to have a table there with our resources, let us know and we can go ahead and do that. We have different events that we participate in: Family Summit, Red Ribbon, Take Back Day. By the way, Take Back Day is coming up. It is in October. This year, it'll be October 24th. That's a Saturday from 10 a.m. to 2 p.m. We don't have the locations yet, so a little bit too early, but please check our website. That way, you know of when locations get updated or added to that website. All right. So last but not least, I'm going to talk to you about the different publications we have. These are all bilingual. Again, if you have an event that you have coming up, you have a specific audience that you want these resources for or publications for, you can find our catalog at getsmartaboutdrugs.gov/publications. We do have our drugs of abuse book, or booklet, I should say. It's pretty thick. It talks about the Controlled Substances Act and what each drug does that's already on there. So we're talking about heroin, fentanyl, cocaine, oxycodone, oxycontin, things like that. It's already in there. So just be aware that it's a pretty useful book. It gets updated every 2 years, so it probably will get updated next year. Drug fact sheets. We have fact sheets on possibly every drug that you can think of: marijuana, fentanyl, fake pills, kratom, depressants, cocaine. I mean, if you look at our catalog, it's in there. Okay, what every parent and caregiver should know about fake pills. It's a pretty good guided fact sheet. If you don't want the book, because we do have a booklet on this, you can get the fact sheet. Maybe you don't want anything too bulky. Maybe you just want to give your parents or your caregivers something simple and light. We have 12 different fact cards, either 12 or 13, English and Spanish. Again, it's on fentanyl, cocaine, heroin, I think drinking and driving also, prescription medication safety, and different substances as well. This is the booklet that I was talking about, the parent guide. It's called Growing Up Drug Free. It did just get updated, so this has the most up-to-date information for that guide. Again, it is cited. It's not just DEA information. And if you're curious about any of these resources, please know that you can preview them before ordering anything with me. So if you want to just look through it really quick to see if it's going to fit your audience, you can actually preview that booklet before you decide to order anything. This one is a brochure on vaping and marijuana concentrates. It's probably the only publication we have on vaping. We don't have too much on vaping because vaping can consist also of nicotine, not just marijuana. So, and we don't regulate nicotine. Nicotine is a legal drug, but marijuana is a little bit different, which is why it's probably the only vaping publication we have. This is more for college campuses. It pretty much it's a guide that guides college campuses or college leadership on how to have that collaboration between the university and students and how to address those drug misuse issues, if there's any. And it also gives you a guide on campus-wide programming for that prevention planning for substances. We have posters as well. So if you know of any teachers or coaches and they want to put something prevention-wise on the locker room or in the locker room, they can put this up, right? Because as we know, unfortunately, a lot of student athletes start misusing substances because they get hurt on the field and they start with opioids. We have bookmarks as well. We also have a fact sheet on National Take Back Day. If you want to order some of those, you definitely can, English and Spanish. This one is very similar to our THC presentation. Again, preventing marijuana use among youth and young adults. We kind of saw a few of those slides. Those slides are pretty similar to what you can find in this booklet. And lastly, we have our prescription for disaster, how teens misuse medicine. This is not a DEA publication. I believe it is SAMHSA, from SAMHSA, but we keep it in our warehouse because we like to disseminate it. SAMHSA is a federal partner, and so we like to share publications among each other as well. And if you have not taken any pictures throughout this presentation, that's completely okay. By the way, you can take pictures of this presentation. Please take a picture of this. Actually, we're going to be sharing this presentation, right, Dr. Riley, as a PDF format, from what I understand? Okay, never mind. You guys don't have to worry about the pictures. But I do like to say this is an important slide because these are our entire 4 different outreach websites that we have. So just think twice. It is mainly for teens. If you have teens in your life, it's a good one for them to go to. Campus drug prevention. It's also a good one for college campuses. Get Smart About Drugs is probably my favorite one for parents, adults, educators, teachers, because it has all of the information that you could possibly need on substances and symptoms and things that you would need to know. Research articles as well. And then this is also where our publications live. So this is where our catalog lives as well. And then Operation Prevention, that is where our curriculum lives. You don't have to sign up for our curriculum or enter any type of information. It is completely free to use, okay? All right, so I know I've talked a lot. I'm gonna play a game with you all really quickly, if that's okay. If you want to guess in the chat what you think is the right answer, that works as well. I'm gonna show you two different pictures and you're gonna tell me which is the real thing. So we're gonna start off with Beyonce. Can you tell me which one is the real Beyonce, one or two?
One.
What do you all think? Okay, let's find out. Good job. And you all know who Beyonce is, right? I'm assuming because every time I give this presentation to kids, they're like, is that Shakira? I'm like, no. I'm like, this is Beyonce. What are you talking about? All right, Nike shoe. Which one is the real Nike shoe? One or two?
Two.
Two, are we in agreement with that? Yeah, two, one. All right. It's actually, yeah, two. Good job. One is a fake one. Let's make this a little harder. This is a Percocet. One is made by a cartel. The other one was seized by our agents from a cartel. Sorry, one is made by a cartel. The other one is what was gotten from a pharmacy. Which one is the real one? Okay, let's find out. Good job. One is the real one. Two is fake. All right. The Xanax or Xannies or bars, which one is the real pill? One or two?
Two.
Two. Okay. I think everyone's saying two so far. Okay, we have 1-1. Okay, let's find out. Two is fake. One is the real one. Okay. And we have to remember that cartels have pill presses, right? They have everything they need to make a pill look like the real thing. That's why it's so tricky sometimes. All right, this other opioid. This is an opioid. Which one is the real pill? One or two? Okay. All right, let's find out. One is fake. Okay, so two is a real pill. And if we kind of like look at these two pills for a bit, we have to remember that cartels are after one thing. What do you think they're after? What is their main goal of doing this? Of course,
Visibility,
money.
the presentation of the pill.
Absolutely right. It's money because we have to remember that this is a business. Their main goal here is to get their money and go to the next buyer. If this pill costs a life to them, that's just a cost of doing business. That's what it is. And so we have to remember that if they're going to be making these fake pills, they are not going to take the time to get that color sequence just right. They want something fast. So they're going to make it blue. Like, it looks kind of bluish. Let's just make it blue, right? They're not going to take care of making it look speckled like this other one does. So just something to keep in mind. All right, last one. Which one do you think are the real pills in this one? One or two? Okay, I see 1, 2. Anyone else? Okay. Well, they're both fake. And that was a trick question. Okay. And the whole point of this game is, when we played in person, if I would be there in person with you, I would make all of you stand up, stretch our legs for a bit because it's been a pretty long presentation. And every time you would get it wrong, you would sit down. And so at the very end, everyone would be sitting down, right? Because that means everyone got it wrong because both of them are fake. And the whole point of this game is that you can't tell when a pill is real by just looking at it. Can anyone tell me what's the one way for sure to know a pill is real? Anyone?
Get it from the pharmacy, from your prescriber?
Yeah, absolutely, right? DEA stance is that the only way to know when a pill is safe is if you get it from your doctor, from a legitimate doctor, and you pick it up from a legitimate pharmacy. So those are the two ways to know for sure that your pill is safe, that it's okay. If you get it from a friend, if you get it from someone else, it's a risk, especially if you're getting it from a prescription bottle, right? And it's someone else's. Then and you don't know how it's going to affect you. That can also be a little risky as well. Now, when I talk to the kids and I tell them about this game and we play this game either high school or middle school, and I tell them or I ask them who are the three most important people right now in your life that you should only be taking medication from. Can you all tell me who those three people are that youth should only be taking medication from? And I guess it's fine.
I only know of two, their parents or their doctors.
Good job. Yes, parents, doctors, and then there's one more.
School nurses.
Absolutely, school nurse. And that's because the parents get the medicine from the doctor, and then the school nurse gets the medication from their parents with maybe a doctor's note, right? So it's all connected. And so we talk a little bit more about that with the kids. But I'm sorry I kind of went a little bit over. It's almost 1. But if you have any questions, please let me know. We do have a listserv. We do have a stakeholder meeting every 3 months where we talk to our Op Engage partners. I know I didn't talk about Operation Engage. That's a program we have in Albuquerque where we do after-school programs. We do Citizens Academy. We do workplace events, things like that. And that program is moving down, or I am moving it down to the Las Cruces area and to the El Paso area. So if you would like to get added to that listserv, please send me an email. Let me know, and we can go from there. I'll go ahead and add you. That's about it. Thank you so much, everyone. I appreciate your time. I'm sorry that I took a little bit longer than what I wanted to. But thank you.
Thank you so much, Michelle. Thank you, thank you, thank you. I repeated Michelle's contact information in the chat. If you did not get it, let me know. But I really do want to thank you, Michelle. And I was asked to be a part of the Health Council talks a few days ago, and I wasn't really prepared for the presentation in that today is my niece's 3rd-year anniversary. She died of a fentanyl overdose in a hotel room and thought she was taking Oxy, and it just was laced with fentanyl. So today's her 3rd-year anniversary that she's passed away, and it's a little bittersweet. So I really appreciate the information and just everything that you were able to share with us. And I also ask everyone who's on the Health Talks today, if you have any events that are going on, especially in light of the conversation this afternoon, please don't hesitate to send that information over. We're happy to send that out to all of our partners and get the word out about what your communities are doing. I don't have any questions right now. I don't know if anyone has any last minute questions before we sign off. Anyone? Okay. Well, thank you so much, Michelle. I really do appreciate it once again. And I hope everyone has a wonderful weekend. And we look forward to sharing out this recording. And everyone should have received an evaluation. If you received that when you registered, please take a few minutes, fill that out, send it to us. We really want to get your feedback. Thank you, everyone.
Thank you, Dr. Riley. I appreciate your time. And I'm so sorry for your loss. Unfortunately, we talked to a lot of parents and people that have lost loved ones, including myself. We're all affected, I think, in some way. So I just wanted to thank you for sharing that. I appreciate it.
Thank you. All right, everyone. Have a good day.
Have a great
Bye.
weekend.
Thank you.
Bye.